right. So to start, can you please just introduce yourself?
I'm Judith Rocha. I am part of this dementia friendly and dementia champions group. I am faculty at Northeastern Illinois University. I am part of the social work department and as an assistant professor, as well as the MSW director of field education. And my connection to dementia and more specifically the Alzheimer's experience is a personal one. I provided care for my mom, my sister and I did during the 16 years of the diagnosis. She was diagnosed at age 68 and she has been now deceased for 16 months. So she was 84 when she passed. So lived the condition out from the point of diagnosis for 16 years.
Can you tell me about the community that you're a part of or the community that you currently serve?
I'm a licensed clinical social worker, and I realized very early on at the time of diagnosis that there was a lot of gaps, and we continued to experience those gaps throughout the 16 years, even to the final moments. Mom only got hospice for a day and a half. These gaps, when it came time for me to pursue what I decided to do when I did was a PhD, and I was given the request to pursue a particular area of research, I realized that what better than my personal experience of caregiving, right? I really focused on the caregiving aspect because I saw that between my sister and I, there were some differences. The community that I feel the need to be more supportive is folks that, like us, definitely need not only things to be in the Spanish language, although I am fluent in English and Spanish. My sister tends to be more comfortable in Spanish. She does speak English, but we needed a lot more than just even translated material, which already is hard to find, right? Elements around practices and information being culturally responsive were important to us. We're definitely responding to the needs that we were facing while having mom at home. Other elements around socioeconomic status and not necessarily having out-of-pocket availability of funds to provide for the things like Medicaid and Medicare we're not covering. Usually socioeconomic status is on the lower end, folks that may be monolingual or strongly preferring Spanish language. So just being able to hold space and support for those folks, even morally, has been important to me.
Are there things that you want people in your community to know about dementia and Alzheimer's?
I would like not only for literature to be available and to be in language that's understandable, and that doesn't only mean in the Spanish language, it really means adjusted to terms that are a lot more relatable than medical jargon. What I'd like to see essentially is a care ambassador or like a journey companion or a team of care that is very much inclusive of the family, or essentially who is going to be potentially supporting this individual. Folks in a church community that could volunteer, that could support this process. Doesn't mean I talk to neighbors a little sooner than I would like, because I may still not even understand the condition myself, but my neighbors need to know that if my loved one ever leaves the house, that everyone has to keep an eye out. It really truly does take more than just the one person that's stepping up to provide more care.
So we've talked about challenges and goals and maybe some of the tougher parts, but can you think of anything that's rewarding or just fun to get into, especially in your specific community?
Some of the things that I've done as a result of moving into the caregiving sector, not only personally but professionally, were things like developing an intervention for Latina caregivers of people living with dementia. A virtual support group that began in May of 2020. We started a support group for Spanish speakers, and it's still going. So it'll be 3 years this May. In the caregivers lending library with different articles and items that they could use for months. We do that every other week. And another project is an art program. It's called La Brocha, which is the paintbrush in Spanish. And it came as a result of taking mom to one of those sip and splash events. I don't know how many elders get a chance to dabble in paint when art making. This is like a painting you can put on your wall. And so connected with a couple of colleagues at that point in time. We sought out a grant of $1,000 at that point. Now we have a budget of 49,000, and that brings a lot of joy to me to see folks really engage in activities and feeling like an environment is truly theirs.
I'm glad there's been a positive side to all of the really hard work. I think I'm going to turn it over then to Richard, who's got a few more just like champion specific questions to talk to you about.
Hi, I wanted to introduce myself first. My name is Richard. I'm an MPH student also at Rush. Just to give you some context, I also have my grandfather who had Alzheimer's and disease, so I had some of the experience with that. And I wanted to say that you're just inspiration for how you're able to keep going and advocate and be able to raise that much money to do those projects. It's just very inspiring. Going into the next question that we have here is, what would you recommend to others that want to make their communities more dementia friendly?
I feel that when we listen to folks, they'll tell you what they need. So I feel really strongly as a social work professional to always make sure to tell my students people are the experts of their experience, right? We're not coming in to say and dictate and provide evidence-based anything. They are still alive. They have endured quite a bit. And so I think it's really important to approach folks not from a deficit lens. We understand there's gaps and challenges, but there's a lot of assets. And so I feel that it's important for folks coming in to spaces that are new to them to ask questions, to find themselves listening to what people are saying, and then really giving back to them what you just heard were the assets and everything that they bring to the table. And then starting from that point, what do you feel is needed here in this space? What do you find would be most important?
Sounds like you're saying to talk to the community and hear what their inputs are and go from there based on their input. I definitely agree with that. So going on next, what was the most successful methods that you've seen for community engagement?
There was a quality of life study being done in Little Village. UIC's public health had been working on this quality of life study for several years, and they seem to have approached it in a culturally responsive way, expressing cultural humility, where they reached out to the agencies that are within the geography of the neighborhood and that service the neighborhood organically. And then also some of the leaders, because some of the leaders in the community are folks that are well connected with other folks, don't necessarily associate with these organizations. Because I think sometimes we assume that community-based organizations are the go-to for everything. Otherwise, if you only focus on community-based organizations, which a lot of researchers tend to do, you're not necessarily covering the gamut of experiences. And so I think it's important to keep that in mind. And that quality of life study, I feel, was successful because they tried to do it in different ways.
Thank you so much. I think that's all the questions that we had planned. We really appreciate your input and all of your answers to these questions. They're really helpful to us.
Thank you again, and have a good rest of your day.